Muscular shoulder anatomy. The rotator cuff consists of four small muscles which effectively form a sleeve around the shoulder and allow us to raise our arms overhead effectively. These muscles, consisting of the supraspinatus, infraspinatus, teres minor, and subscapularis, oppose the action of the deltoid muscle and depress, hold down the head of the humerus upper arm during shoulder elevation to prevent impingement. This allows you to effectively raise your arm and reach in certain ways without experiencing impingement of the soft tissue between the top of the shoulder blade acromion and the head of the humerus. For the purposes of this book, I will not discuss in detail the origins and insertions of each particular muscle or elaborate on the nerves that innervate them. However, it is important to understand that pain in the shoulder area can also be referred from the neck. Therefore, one should not always assume that pain in the upper arm is due to adhesive capsulitis, rotator cuff injury, or tendinitis. Weakness can be seen with neck or shoulder dysfunction. As such, it is always wise to consult your physician if such a problem arises. Below, I will summarize the role of each rotator cuff muscle. One note to consider: damage to one structure may not always lead to significant functional weakness or limitation. These muscles work collectively and synergistically with the scapular muscles to produce purposeful movement. As such, the body is able to compensate for power deficiencies in many cases. These compensations may be subtle or obvious. The infraspinatus and teres minor muscles are not pictured as they are positioned in the back of the shoulder blade. This illustration only refers to the front of the shoulder. Rotator cuff muscles. Supraspinatus, largely responsible for initiating elevation from 0 to 30 degrees of abduction, arm moving away from the parallel of the body, and assisting with elevation. This muscle has a poor blood supply, lies beneath the acromion, and is often the most commonly affected tendon with regard to tendinitis or tears. Because of its poor blood supply, it heals slowly and is prone to recurrent bouts of inflammation. Infraspinatus, responsible for externally rotating the arm or moving it away from the body when the arm is at the side or when cocking to throw a baseball. This muscle also helps decelerate the arm during follow through from an overhead motion, that is pitching. Teres minor, also responsible for external rotation in the same way the infraspinatus functions. In addition, it also helps decelerate the arm during follow through from an overhead motion, that is pitching. Subscapularis, responsible for internal rotation or pulling the arm in toward the body while at the side. This muscle also assists in follow through during throwing because this muscle performs the same action as that of the pectoralis major, latissimus dorsi, and teres major. It is sometimes difficult to detect weakness. Equally important to the proper function of the shoulder is a group of muscles known as scapular stabilizers. These muscles have attachments to the scapula, shoulder blade, and directly contribute to shoulder motion by affecting the path of movement of the shoulder blade. These muscles work synergistically together with the rotator cuff to ensure smooth movements without shoulder impingement. You see, for every 2 degrees of shoulder abduction, arm movement away from the body in the same plane as the body, there is 1 degree of scapular elevation. The shoulder blade moves in addition to arm to allow for the great freedom of movement we enjoy. With weakness or injury, this rhythm of movement becomes altered. Scapular stabilizer muscles. Serratus anterior protracts or rounds the shoulder blade. Upper trapezius shrugs and upwardly rotates the shoulder blade. Middle trapezius retracts or pinches the shoulder blade inward. Lower trapezius depresses and upwardly rotate the shoulder blade. Rhomboids retract or pinches the shoulder blade inward. strengthening exercises. Below you will find a collection of appropriate scapular stabilizer and rotator cuff exercises. These exercises are designed to improve posture, correct muscular imbalances, and strengthen the rotator cuff. In cases of a frozen shoulder, the restricted motion in the shoulder joint often compromises the function of the rotator cuff and may lead to impingement. In other cases, impingement and tendinitis actually leads to the frozen shoulder. Regardless, the rotator cuff needs specific strengthening to aid in healing and recovery from this disorder. Keeping strict form and performing these exercises in a safe, pain-free range of motion is essential. They are not intended to build lean muscle. While there is no definitive order in which to perform these exercises, I generally suggest that you do the scapular exercises first since they are the larger muscle group. The scapular exercises help restore and maintain proper movement of the shoulder blade in relation to the shoulder itself. Because of the restricted movement in the shoulder joint, there are compensatory abnormal movements from the scapula to help you achieve desired movements. While you have little control over this, performing these exercises will help in your quest to gain back the normal use of the shoulder again. Try to focus on keeping the shoulder blades down and in toward the spine. This reinforces proper positioning of the shoulder blades and prevents abnormal scapular movement patterns. Scapular stabilizer exercises. Standing tubing row. This strengthens the middle trapezius, posterior deltoid, and rhomboids. Using a pole or door, position the tubing so that the handles are even. Stand with the feet shoulder width apart and the knees slightly bent, relaxed. Beginning with some resistance, tube is taut. Pull toward the body, squeezing the shoulder blades together and keep the elbows at your side. Pause for 1 to 2 seconds and then return to the starting position. Perform 2 to 3 sets of 10 to 15 repetitions. This can also be done with a machine. Serratus anterior DB punches. This strengthens the serratus anterior, a muscle which helps to stabilize the shoulder blade during arm elevation. Laying on the back with the knees bent and feet flat, press the dumbbells toward the ceiling, making sure to keep the elbows straight. The shoulder blades will round forward and lift off the floor. Pause at the top of the movement and lower with control to the starting position. Perform 2 sets of 15 repetitions. Prone horizontal abduction raise. This strengthens the middle trapezius and rhomboids, which promote good posture. Using a stability ball, raise the arm out away from the body until they are near parallel to the floor. Keep the palms down and pinch the shoulder blades together at the top of the motion. Lower slowly to the starting position. It is also acceptable to do this exercise lying face down on a bench as perform 2 sets of 15 repetitions. Prone lower trap raise. This strengthens the lower trapezius, which is often weak and fatigues quickly. This muscle depresses the shoulder blade and prevents impingement. Using a stability ball, raise the arms up in a 45-degree angle as far as the shoulder allow without discomfort. Pause at the top and lower slowly to the starting position. This is an awkward motion and it is best to use a lightweight and focus on controlling the motion. It is also acceptable to do this exercise lying face down on a bench. Perform 2 sets of 15 repetitions. Shoulder shrugs. This strengthens the upper trapezius. In standing with the arms resting at the side of the body, shrug the shoulders straight up toward the ceiling. Pause at the top for 1 to 2 seconds. Slowly lower the weight to the starting position. It is important not to roll the shoulders forward or backward, as this may cause grating of the scapula in the chest wall. Not to mention the upper trap muscle's primary action is shoulder elevation. Perform 2 sets of 10 to 15 repetitions. While there are certainly more exercises you could do, I have attempted to provide you with the most important ones here. These exercises will help move the shoulder blade and strengthen the scapular muscles. In the next section, I will provide Essential rotator cuff strengthening exercises to include in your program. Rotator cuff exercises. Scaption. This strengthens the supraspinatus muscle, the most commonly affected rotator cuff muscle and slowest to heal. Begin in a standing with knees slightly bent, relaxed. Hold the dumbbells in such a way that your thumbs are up or on top of the dumbbells. Keep the arms approximately 30 to 45 degrees forward from being perpendicular or straight out away from the body scapular plane and raise the arms up to the shoulder height. Pause at the top and slowly lower the starting position. Keep the elbow straight throughout the entire movement. Avoid any part of the range of motion that causes pain. Perform 2 sets of 15 to 20 repetitions. Internal rotation. This strengthens the subscapularis muscle as well as the chest muscles. In standing with knees relaxed, hold tubing and begin with the arm positioned at the side, neutral, with light tension on the tubing. Now pull the arm across the body to the stomach while keeping the elbow at your side. Do not allow the shoulder to rotate forward. Perform 2 sets of 15 to 20 repetitions. External rotation tubing. This strengthens the infraspinatus and teres minor muscles. In standing with the knees relaxed, hold tubing and begin with the arm positioned at the side, neutral with light tension on the tubing. Now pull the arm away from the body while keeping the elbow close to your side. Do not allow shoulder to rotate backward. Perform 2 sets of 15 to 20 repetitions. Horizontal external rotation. This strengthens the infraspinatus, teres minor and posterior deltoid. It also works the shoulder in a more functional plane. Sitting on a stability ball or bench, begin with the arm 90 degrees away from the body with the palm of the hand facing the floor. Raise the dumbbell up 90 degrees and slowly return to the starting position. Perform 2 sets of 15 to 20 repetitions. Note, the horizontal external rotation exercise can be done without weight as well. The primary purpose is to improve functional range of motion and strengthen the posterior rotator cuff. In conclusion, I want to remind you that you may not need all of these exercises to improve your shoulder function. To the best of your ability, you should test your range of motion to see what is painful and limited. Use that information to help guide your selection in the end. With that being said, here are some specific guidelines to follow depending on which phase of the process you are going through. Review of key exercise for frozen shoulder. Stretches. Perform all these stretches based on your pain tolerance twice daily. It is best to do them after a warm shower or using a heat pack for 15 to 20 minutes. If you are experiencing acute pain, significant pain before the tightness sets in and stops the motion, it is best to utilize passive stretching exercises as tolerated. Otherwise, use active assistive or active stretching. Range of motion. Perform all the exercises based on your pain and tolerance twice daily. Even if you do have full motion in one direction, I am of the opinion it is wise to maintain that in addition to improving the stiff motions. Again, utilize passive range of motion exercises with acute pain and active assistive or active exercises with motion more limited by stiffness and pain at the end range of motion. Strengthening. Provided you can do the exercises with minimal to no pain, I advocate doing 2 sets of 10 to 15 repetitions of each one. Attempt to perform 2 to 3 days per week with at least 1 day of rest in between. I typically advise doing these after the stretching and range of motion exercises have been completed. Specific considerations for different phases. Freezing. Pain is usually intense in this phase, so every effort should be made to minimize activities that cause discomfort. We should concentrate on heat cold for pain relief as well as range of motion and stretching exercises without increasing pain. If pain allows, incorporate some of the strengthening exercises. The intensity of the stretching and range of motion should be based strictly on your discomfort levels, as increasing inflammation with vigorous stretching will only serve to make you feel more miserable. Frozen. In this phase, the stiffness actually worsens as the pain typically lessens. It becomes more necessary to increase the intensity of the stretching and range of motion exercises in order to prevent further motion loss and stiffness. It is okay to experience some pain at this point. I typically advise no greater than 5 by 10 or moderate pain. Overall, any increased soreness should not persist greater than 24 hours. If so, it is important to ease up on the stretching. You should be using the strengthening exercises to complement the healing. Thawing stage. During this phase, it is still important to push for full range of motion as tolerated. I also feel it is critical to incorporate the strengthening exercises routinely to prevent impingement and unnecessary pain as you begin to use the arm more again. You may be able to wean off certain stretches at this point depending on which motions have been restored and which ones are still restricted. Why do most people fail with a home program? The answer is simple. Either they push too hard and perpetually exacerbate their pain and inflammation, or they do not stretch intensely enough. In most cases, they are also inconsistent. You must grade the exercise accordingly based on your pain, and you must do the stretches and range of motion exercises daily. If not, you are fighting on uphill battle. Summary of activities to avoid with frozen shoulder: heavy lifting, carrying heavy luggage or packs, repetitive overhead lifting, swimming, throwing, heavy impact activities, sudden reaching movements, and of course, painful activities. So, what can you do? The answer is anything that does not significantly increase your pain. You need to balance the use of your arm with the pain associated with that use. Much like arthritis, moderation is the key to success. Listen to your body, follow the program, and you will see positive results. I wish you the best in your recovery. In the following pages, I will summarize the daily stretches and range of motion exercises for you on one page. This will allow you to refer quickly to one sheet while performing your exercises and easily take this reference sheet with you when you travel. I have also specified my preferred order of exercises, although you can change this based on your preference and results. Please keep in mind that the quality of the stretching is far more important than the quantity of stretching. Stiff shoulder stretching and range of motion routine. Heat prior to exercise. Apply a hot pack. Moist heat is preferable to the affected shoulder for 15 minutes prior to the exercises. Be sure to place a small pillow beneath the shoulder so that elbow is supported and the shoulder is comfortable throughout. Caution: do not place the heat directly on your skin. Pendulums: perform 15 to 25 repetitions clockwise and counterclockwise. Range of motion exercises with cane. Lying flexion 1 set of 15. Lying horizontal abduction adduction 1 set of 15. Lying horizontal external rotation, standing scaption, standing flexion, standing external rotation, standing extension, standing internal rotation. All these 1 set of 15 repetitions. Stretching: standing flexion wall slide 1 set of 10 to 15 repetitions, 5 to 10 seconds hold. Standing posterior capsule 3 into 30 seconds. Standing external rotation with 0 degree abduction side 3 into 30 seconds. Standing external rotation with 90 degree abduction 3 into 30 seconds. Lying posterior capsule 3 into 30 seconds. Standing internal rotation with towel 3 into 30 seconds. Pulley if available. Perform 10 to 20 repetitions of up and down movement, full range available. Next, raise the arm affected 10 times and hold for 10 seconds, somewhat vigorous stretching. Finally, raise the affected arm up and hold for 1 minute. Repeat 1 to 3 times as tolerated. Low intensity and longer duration stretch. Upon completion, you may want to ice for 15 minutes to reduce any post exercise soreness. Medical disclaimer: the information contained within this stretching guide is not intended to replace professional medical care by a physician or a physical therapist. It is simply designed to improve shoulder function and range of motion related to the previously specified shoulder disorders. If you suffer acute injury, persistent pain, or significantly limited daily function and use of your arm, it is recommended that you seek a complete professional evaluation from your physician. In closing, I sincerely hope you can reap the benefits of putting these exercise strategies to work in your quest for improved shoulder function. These methods have been clinically tested, and I am supremely confident that you will enjoy a happier, healthier life by utilizing these concepts in your recovery.